everyone, welcome back to my channel. Today I had a special opportunity to talk to Dr. Rohit Kapoor more about getting into the medical field. Also, I think we went more in depth about medical school in India, but I do recommend you listen very closely because he does give out some interesting tips and advice, and he does have very nice motivational quotes to motivate you alongside. Overall, I enjoyed a lot, and thank you, Dr. Rohit Kapoor, if you're watching this, for coming up and talking to me and supporting youth like us passionate about going into the medical field. Dr. Kapoor did give me his information, and I have linked everything down in the description, so feel free to contact him. And you could also view this episode on my podcast. I will link it down in the description as well. So, without further ado, let's get started.
Hello, guys. Actually, I am Dr. Rohit Kapoor. Actually, I started my journey as an MBBS student in Safdarjung Hospital. It is
Mhm.
located in the heart of India. It's in New Delhi.
Yeah.
Eventually, after MBBS, I did my MD in Pediatrics, and
Mhm.
subsequently, I was a medical officer after clearing UPSC, and I cleared all my USFD steps. I entered into the residency in United States. I did my residency in
Mhm.
St. John Hospital, Detroit, Michigan, United States. Eventually, after completing the residency, I came back India. I did my super specialty training in pediatric hematology,
Mhm.
oncology, and bone marrow transplant. Eventually, I did transplants in adults as well
Mhm.
after rotating in three super specialty hospitals and one hospital in the government setting, which is the highest apex center, which is the Delhi State Cancer Institute. And eventually, I became a consultant in Max Hospital, Vaishali, which is a super specialty hospital, and
Yeah.
we cater a lot of patients with transplant and a lot of patients with CAR cell therapy. And we treat leukemias, lymphomas, and pediatric tumors, and we do also do pediatric stem cell transplant actually. So, really nice talking to young, dynamic, fantastic people out there. In fact, and the key thing is they are figuring out what they really want to do, and this is the best time actually. I would rather say that
Mhm.
it's a fantastic time to think, to make the journey. How And the planning is the must thing that has to be done at this point of time, so that you excel the best in your career, and along with
Mhm.
a good satisfaction in your career as well. So, very nice talking to young, budding little kids
Mhm.
actually out there.
I mean,
And
that seems like a whole lot, and I'm really so lucky to be able to talk to you about like all that stuff. I mean, you said Michigan, and Michigan is like I think a few hours drive from here in like Minnesota. So I mean, it personally, it's going to be a lot of information, and I really appreciate how you're able to connect with youth like us who are really interested. And we're so lucky to have you guys as mentors. Like in nowadays society, we don't even get mentors. Like it's so much busy, and then some people don't want to come up. So I really appreciate how you're coming up and talking to us and like inspiring us every day. But
yeah,
I would
me,
say
yeah.
like, how was your experience in, like, medical school in, like, India? Like, I have not heard of that yet.
Okay, so medical school in India is like you are exposed to all sort of patients
Yeah.
at a very early age. So the main thing in India is a lot of hands-on, even as a medical student. And
Mhm.
the main thing is, in as a medical student, we used to year-wise actually we had rotations. In fact, so first year
Yeah.
was practically a non clinical year. It was like a
Mhm.
medical year, paraclinical year, in which you learn dissection, anatomy.
Okay.
You like biochemistry is the other thing that you have to do,
Mhm.
and physiology. So these things are the roots of all the medical science. So beyond that, in the second year, you become like partially clinical, partially like kind of
Mhm.
theoretical guy, and in the third year you practically become more clinical. In the second year you tend to do forensics,
Yeah.
tend to do pathology and microbiology, and all these subjects. They lay the foundation for the clinical stuff actually,
Mhm.
because in third year you get to know ophthalmology, you get to know ENT, and you also get to know further portions of general surgery.
Yeah.
And the final year you tend to know about more of medicine, surgery, orthopedics, pediatrics, all the blends. So
Mhm.
as we move from bottom to top, so from non-clinical branch you become become acclimated to the clinical branch. So main thing is ki the patient care, you tend to learn the patient care eventually, and you tend to become more focused on the patient based approach. Yet the base has to be pretty strong. So the first few years of the medical school, they
Mm-hmm.
really make you strong or weak. The main thing is
Mm-hmm.
anatomy should be strong for surgeon. Okay, so if you want to go ahead with biochemistry, all the processes and physiology, all the processes and management on the
Mm-hmm.
level of patient. Like if you have to read the ABG, you would be learning that in physiology. If all the muscle contraction you need to learn, you have to learn it in physiology. Okay, so in biochemistry you learn to know what exactly is the cycle, how is the ATP generated, how exactly the ATP would be used. And implications are actually like very very high of this, because we still use physiology, we still
Yeah.
use ventilation, we still use ABG to read whether this patient will go to ventilator and whether this patient does not need any ventilator. So physiology has to be strong if you have to go into medicine. So
Mm-hmm.
if you are really wanting to be a surgeon, your hands in anatomy, your dissection skills, because the cadaver will make you learn a lot. So the cadaver is the main thing that if the person wants to go into surgery, your hand have to be firm. You need to
Mm-hmm.
handle, you need to the making incision, and stitching, suturing,
Yeah.
interpreting parts of the internal body. They have to be very very perfect if you want to become a surgeon later on. So the first year in medical school correlates well with the final year of the medical school, in fact,
Mm-hmm.
because the general surgery and general medicine will lay the path, give where exactly you want to go, what exactly you want to be, what
Yeah.
exactly you want to do residency in. So these are the basic things. So in India there is a lot of exposure to
Mm-hmm.
all these things. Actually the tertiary care units are the units in which all the referrals come. So
Yeah.
all the patients from various parts of India, they tend to come to the tertiary care center.
Mm-hmm.
And we had exposure to all sorts of patients with polytrauma, all sorts
Mm-hmm.
of patients with multiple lacerations,
Mm-hmm.
all sorts of managed patients, like the patients who are malmanaged even, or
Mm-hmm.
patients who are having acute heart attacks and MI, and multiple medicine related issues like chronic kidney disease and all those things. So the patient load in India, actually it's pretty high. So what really happens, you work at eventually you learn it quickly, and you later on become spinal. You think and you tend to perform that thing even without thinking. So the main thing is, if you are becoming a really good doctor, you are becoming much more spinal, and your reflexes are
Yeah.
getting stronger and stronger,
Mm-hmm.
and it really comes with experience. So patient load, different set of patients, amalgamation of all the these subjects you have done in the medical years, that would really play a role in making you how exactly you're going to do in your residency.
Mm-hmm.
And beyond residency, fellowship comes, that I'll discuss with you once we move ahead.
Yeah, I mean, it sounds like a whole like schedule full of like hands-on and theory together. And I know that you mentioned like anatomy, physiology, and like other biochemistry, these subjects. And so what kind of amazes me is that since I'm in high school in Minnesota right now, we do have like college and high school programs where we're doing anatomy and physiology dissection in high school. And like last year, I did my certified nursing assistant license. So would you say like these licenses are able, like, are you able to get these in like high school there? Because I'm not really sure about the curriculum, but I would say it's really good that we're getting a head start here as well. So I would like to know if you have like the similar kind of programs there.
In India, actually, high school does not really have these sort of programs.
Mm-hmm.
But I'm really glad to hear that if these programs are existing over there, they you are getting trained upfront in practically anatomy, and you are learning the great set of skills which we actually tend to learn in the first year of medical school.
Yeah.
And if you're learning that earlier on, it would rather, I would say, it's much better. It's a
Mm-hmm.
good thing that is happening like over there, which does not really happen in India. In India, actually, the high school can be equated to class 11 and 12, in which you just tend to keep studying, you just keep cramming all the
Yeah.
stuff. The practical things are not much taken care of in India. In fact, I would rather say, but they are much in United States. Things are oriented like the practicality is much more focused on in United States rather than in India. In India, there is a rank system, and the person who learns the best gets the best rank, but
Yeah,
he
I
may or
agree.
may not be a very good guy at clinical skills. So
Mm-hmm.
the marks cannot directly dictate that this person would be doing fantastic in the clinically or in his clinical skills, or later on after residency, or later on as a doctor. It has a poor predictive value. So like
Yeah.
in USMLE exam, there was a system which was known as the percentile scoring. And the main thing in the percentile scoring, it was written in the percentile report, just beneath
Mm-hmm.
the exam report, which we get step 1, step 2, step
Yeah.
to CKCS, and step 3, that this percentile does not really equate that this person, if even if he's or she scores more than 260, would be doing that much great in the clinical skills or in the surgical skills. It reflects the knowledge only. It
Mm-hmm.
reflects the knowledge. So it the percentile score should be actually linked with the the clinical assessment skills, and the clinically how the person is doing in the real system settings and real hospital settings. So it does not really equate. So in
Yeah,
India, the marks are the key things that the parents push, that you should attain good marks, you should enter into good medical
I
school,
agree.
then you will be doing better. But the thing is, this is also okay, but the thing is the clinical touch and the clinical band is less taken care of, which is much more taken care of over there, as I can hear from you. So it is a blend actually. Even if the person is scoring 2 to 20 marks in the USMLE exam, maybe
Mm-hmm.
a good clinician, because the amount of the learning which he has done in 220, he is able to apply. So
Yeah.
main thing is the application. So if you
Mm-hmm.
are applying it better, and if you are really loving the anatomy classes in the high school, and you really want to be a surgeon, then you have to think that I am gonna be a surgeon. I love suturing. I love fixing the patients and all these things. Or
Mm-hmm.
medicine, like after giving some medicine, you cure the patient, so person. So you tend to go in that direction. So clinically, knowledge application, linking the knowledge with the patient or the person whom you are treating, that's the key thing.
Yeah. So, would you say that as like someone in high school in India, they want to come abroad for programs? Like I know there are programs hosted by Harvard, there's programs hosted by Yale, summer school. They have like, summer we have a summer break of like 3 or 4 months, and then they host like biochemistry workshops. Um it's fully funded. Sometimes like I'm shocked to see that it's, fully funded for international students. Would you say that would be like a really big important thing to put on your resume that you flew from India to US to get like experience that you're not able to get in India at that moment?
Yeah, so a really nice question actually. The thing is that the programs that are funded for the international graduates or international students to learn over here in India, as these can be grouped as two programs basically.
Mhm,
Some travel scholarship programs, or exchange student programs,
mhm,
and thirdly self-funded programs, and fourth even university funded programs. So there are four set of things actually. So the main thing is, if there is a learning that is
yeah,
that which can be acquired and can be applied in India, and which is not there, then the university takes an initiative for the visa, takes an initiative for funding, and takes an
mhm,
initiative for the best candidate who is currently there in their institution, and send that guy as an to learn that particular new method, technique, knowledge, or skill, or activity, and that it can implement in India, and then it can be executed in India. I can
yeah,
give an example.
mhm,
So car cell therapy actually it's used in cancer therapeutics, and you are already aware because you are in US. And in India, the first generation car cell therapy has come like now, in fact, the CD19 car. And it was there in US like around in 2004. Actually, it
yeah,
was so the key thing is ki the car cell therapy we learned from United States, and we are applying
mhm,
over here on our patients. So it's a new thing. So the hospital will earn from
yeah,
whom? From us. So
yeah,
that's the hospital's revenue. We are the source of revenue to the hospital. So they want us to learn that technique,
mhm,
learn that technique, come back and apply over here so that the hospital can generate actually millions of dollars here in India. So this is a corporate funding program which the
Yeah.
hospital do or a university does,
Mm-hmm.
so that they can learn from outside and and can be applied over here.
Uh,
Second is self funded programs.
mm-hmm.
If you really love some surgery or surgical
Yeah.
skills, okay, so you can spend certain amount of money, search for a mentor out there, and then you can come back and use those skills over here. And the last but not the least is the student programs that are
Mm-hmm.
exchange programs, which are on like a F1 visa. And
Yeah.
in these things, actually, there is an exchange program in which the student is again funded by the university or the hospital or an institution, or
Mm-hmm.
sometimes self-funded. And that person is there for a certain set of time with a valid visa, and eventually the visa
Yeah.
expires and the person has to come back. So these are the four things that are like there in Indian setting. In fact, the key thing is the knowledge base which you are learning over there. It remains there in the United States, and you are you're not funneling that knowledge over here. That's why they probably charge you, and the funding over here can be. But the case over here in India is different because the
Mm-hmm.
funding system operates differently. So
Yeah.
because our system comes in a middle income nation,
Mm-hmm.
and LMIC or middle income country nations. So the charges for all the study expenses are based upon the middle income country nation. So the charges are
Mm-hmm.
totally different, because if we enroll in a US program,
Mm-hmm.
we give the money based upon the LMIC or middle income funded nation. So it is always less as compared to the
Yeah.
US, which is a high income nation. So that's why the price disparity comes. But most
Mm-hmm.
of the LMIC and medium funded nation guys, can be easily funded by the university if we put a document that we are pretty eligible for that, and that funding is done to us, and it can be transferred to the US institution, and the person can study, but it has a visa, valid visa, and they have to come back.
Mm-hmm.
That's the main limitation of this program. So that's probably
Yeah.
answers your query.
Yeah, yeah. I mean, it clears up like practically almost everything because like I've been seeing, and also these come up really randomly when you're on Instagram. You see, okay, this is like a whole funded scholarship. Is this actually worth it? Traveling to like not like as someone based in the US, I'm thinking twice, am I supposed to go to another state for this? But it does clear up like a lot for those who are planning to come from another country. But you also mentioned about like the cancer cell and everything. So one technology that I've been seeing really recently is I think the CRISPR kit, which is the gene editing, I would say,
Yeah,
that technology, and I think
correct.
it's like expanding over different countries, and then yeah, I totally agree with that. And I mean, I'm really into genetic editing, and I've been reading a lot about the CRISPR kit, and it's nice to know that how these technologies are kind of like they're getting shared upon like these countries and um yeah, I mean, that really answers most of my questions about these programs. But you know how we take the MCAT in US when we're in medical school? So I did hear about the NEET, and I do want to ask like is it something you recommend like is it necessary to take the NEET at like start preparing from like a high school level? Because I know some people they're preparing like as a high schooler, and that really kind of like intrigues me because for us, MCAT is, like, in university, not even at, like, 1st year, like, 2nd year around the end of 1st year taking the MCAT, and here these people are starting from, like, high school, and so I would love to hear more about that.
Actually, the question is really good. The important thing is, yeah. So the main thing about this is that earlier you start,
Yeah.
more strong would you would become. So, for example, after 10th over here, which is considered as high school, and senior secondary as, and 12th as senior secondary in India.
Mhm.
So at 10th itself, once the we give the board exams analogous to you, the mom and dad, they pressurize us that you have to become doctor. We
Mhm.
are sent to various institutions like coaching institutions, so that we can learn and we can have an edge over the NEET exams or the super specialty the specialty exams or the entrance exams. So the main thing is earlier you start, earlier you are much focused, and much focused you are earlier on, you will do really good because the main thing is, it would really give you a reinforcement that I'm gonna do this. And
Yeah.
so earlier you start, more focused you are earlier on, it would really make an edge, because the scores would certainly improve, if you start pretty earlier, and it would further give an edge in the competitive base as well.
Mm-hmm.
So the seniors who have been doing hard work like you, and have been making notes, or have been having access to various resources that would
Mm-hmm.
really help you to excel in the future exams. So those, you have to make friends and a good positive circle around you, so that you can benefit from them, in fact, and you can even
Yeah.
learn from mistakes. Some people give exams later on, in fact,
Mm-hmm.
and they tell that, if we would have done this, we would have scored much better. So better
Mm-hmm.
to start earlier on,
Yeah.
better to focus on the skills earlier on, better to focus on the books, and you're just not hovering everywhere that
Mm-hmm.
let me do all the books, and in the end you are nowhere, you are unable to
Mm-hmm.
revise. So focus should be made earlier on. Good set of friend circle should be there,
Mm-hmm.
and the books should be right, the focus should be right, the direction should be right, and the main thing is revision. Earlier you start on, more revisions you will make, more form you will become with your exams, and your targets and your missions and your goal and objectives will be much better and
Yeah.
focused on earlier on.
Okay, so here in like US, I don't want to like mix or jumble things up because I know where there's certain expectations that you're supposed to do in India, certain expectations here. So one expectation here is that you publish research. So when you're in applying for undergraduate, they have like a separate field saying, okay, did you do research? But as a high school, that's intimidating. Like you're doing research like at a like a professional level, and then you do is like volunteer work. You have volunteer work, you like have organizations, and like you have all these extracurriculars, not only medical related but even sports. So you have to be like a varsity sports athlete. So when it comes to like US, these are the expectation that they have to get into a good
Yeah,
medical school or into a good
yeah.
university. But in India, I would like to know, like, for a strong application, what type of extracurriculars do you think would be beneficial to look at from like high school itself?
So in India, actually, there is no such inclusion or exclusion criteria.
Mhm.
I would rather use a medical term. There's an inclusion criteria in
Yeah.
research and exclusion criteria in research. So it does not really operate like as in United States.
Mhm.
So there is no need for any kind of extracurricular requirements like
Yeah.
music, or like dance, or
Mhm.
some sort of the good, sporty guy, like doing good at sports. So it is not graded. It is not,
Yeah.
it is an extracurricular thing, but it is not actually graded as your as a need to get entry into medical school, in fact.
Mhm.
So it is a side talent, but it just adds on, but it does not add to the grade. This is not that mandatory in India, but it should be. In fact, the person should be all rounder, should be having good skills, sport skills, should have good intellectual and academic skills. So the wholesome learning in United States is, when compared to India, is, I would say it is much better, because it makes you a wholesome doctor, in fact. The key thing is, these things, the sports, these are needed, in fact, because the residency is pretty stressful.
Yeah.
The super specialty is pretty
Mhm.
stressful, and if you do not have any kind of hobbies, you'll just get crazy, actually, because all around you there would be, patients, stress. You are doing
Yeah.
CPR, you are, the here and there, there is a bleeding person coming up,
Yeah.
gunshot wound,
Coping.
all those things. So you need to have hobbies, you need to have
Mhm.
sport skills, you need to uh, have side talents, in fact, so that these are needed to de-stress you.
Yeah.
So the persons who do not really have these talents, or you do not have, they do not run, they do not jog, or they do not listen to music, they tend to get more depressed, they have suicidal thoughts even during residency, they do not do well as compared to their peers. Plus, they tend to drink more. There is research
Mhm.
and study, they tend to have much more addictions if they do not have any kind of hobbies. So the
Yeah.
hobbies are needed, sports is needed, it is needed in residency. You
Mm-hmm.
need a
Very
time
much.
out. Otherwise you'll blast and become, your system will become very very toxic. You need
Mm-hmm.
your you would not be able to good at even work. So in fellowship it is needed much more, because in fellowship it becomes much more focused. The patients are much more sicker as compared to the general residency program. So in medicine you'll get some stomach burn, but in gastroenterology you'll get directly a bleed and you have to burn that vessel and you have to do urgent endoscopy. So that is
Mm-hmm.
much more stressful. So
Yeah.
hobbies will help to de-stress you. So you need it. But in India, it is not much stressed upon, but they are needed,
Yeah.
really.
I understand like the work-life balance. Like I totally understand that point. It's like that was one of like the myths that I was gonna ask you to debunk is like, do medical students have like a work-life balance, because they're always running around. But I mean, you explain it really well how it's important to have hobbies and like exercising to keep your mind fresh because you're coping with multiple patients and like if a patient
Yeah,
passes away, it's gonna affect you because you're a resident, like
yeah,
you're doing residency. Um,
absolutely. In residency is, will lay a payment for you for throughout your life. In fact,
mhm.
the main thing is whatever you learn in your residency, you'll remember the patient's face, the things you did right and wrong, or you learned from the patients, and all those things that you would have done or not done in order to save or handle it much more better. So if you do not really have any hobbies, you would not be able to get through the even residency, because the main thing is as your as your steps increase in the residency, in the year, or residency year increase, it becomes much more stressful and the responsibility they increase. So because you would be handling the junior residents under you, the junior residents as you become a senior resident, so it is much more stressful in handling the others and fixing the other people mess. So and when you become a attending, in fact, so
Yeah.
you would be taking care of all the residents. So if you do not have a hobby, if you do not have a place to de-stress yourself, if you do not have any sports, you'll become crazy. Really,
Yeah.
you need it. You really
Yeah,
need it.
no, I agree. I agree like 100%. Like, that's super important because my mom keeps telling me, and I keep telling her, no, I'm not going to start exercising from now. But now that you like put it out, now I'm like aware that how important it is. How would you choose like your own branch within the medical field? Because I know there's like so many. You can be a surgeon, you can be like a pediatrician, you can be general medicine, and blah blah blah. Um, how do you know what is best for you?
So you gonna in India, actually the internship tells you what exactly you're gonna
Yeah.
become in life, actually. So in internship you rotate across all the medical rotations, like starting from anesthesia, if you want to
Mm-hmm.
become an anesthesiologist. So in medicine, you have full hands-on in the ER. Do whatever you want in the ER. If you love medicine and you're much more attached to the medicine, and you really feel good in whom you are treating surgically or medically, you should be opting that. And you tend to learn it when not in the exams, not
Yeah.
as a part of medical school, but you become an intern, like in India. But in US, it is like you go internship at parallel only. So
Mm-hmm.
during this time in internship, you tend to learn what exactly fits you the best and what exactly you're gonna do best in throughout your life, and
Mm-hmm.
you have to attach to it. Like I would rather say, if you really like kids, you really like to treat kids, then you should choose pediatrics, obviously,
Yeah.
because you would be doing best in that field.
Mhm,
So
obviously.
yeah, and the main thing is you do not have to it should come from your heart, actually, that
Mhm,
that
yeah.
this is the field I'm I will do really good in this field. So, and it would really help the kids out there. And if you are not attached to the field, you'll not excel in that field, and practically you would be frustrated, and the patient also would be frustrated.
Yeah.
The outcomes would not be that much good. So it is like all hands on.
Mhm,
So you touch the kid, you fix the kid, and you feel better that I did much better job
mhm,
in fixing the kid, or fixing the surgical. My hands are good in surgery. You tend to learn it. You tend to see that I am a fit or not. So you
yeah.
tend to learn it as a clinician,
Mhm,
in internship in India.
Yeah, and I mean, lastly, I would like ask you, like, is it important to build like a social profile, like network, build like a social profile, like, while you're in medical school, when you're pursuing medicine, does it really help you out? Like, getting invited as guest speakers or like having that profile just out there, you know?
uh, this is the age of social media actually, in
Yeah.
fact, but the thing is you do not really have to carry it away with the
Mm-hmm.
bad aspects of the social media. There are good aspects of the social media actually. You have to find your mentor from social media, like who is doing the best, who is your best teacher, who you really have to follow, who exactly are your peers, who
Yeah.
exactly you're gonna you want to become like in future.
Mm-hmm.
So that what exactly social media should be used for. The social media can be used for positive things actually. So how to outreach whatever the social activities you really want to do, you really
Mm-hmm.
want to go to this build a good social circle and learn from those social circle and attach to those social websites that give you good
Yeah.
information and important information and a focused learning or a medicine or a surgical branch related learning or something like that you want to really become in future. And they also give you the good set of feeds from the various surgeons or medicine people out there, so that you can learn from their experiences. So
Yeah.
it again depends upon what exactly you are using the social media for.
Mm-hmm.
The if you wanna use it like a for making reels or something like that, then it would
Mm-hmm.
really not help you much. But if you learn from your social media that and make it a resource rather than just being wasting time on it, you have the focus is the key. So the
Yeah.
learning is the key. Twitter is an
Mm-hmm.
important social media app, in which the focus is all on learning, and you can directly reach to the various cancer specialists all over the world. So
Mm-hmm.
you have to make friends that are senior to you, that know more than you, have a better experience than you, and they have they're much more focused in what exactly they are doing and what you really want to become like
Mm-hmm.
them. And you have to choose your mentor from the Twitter actually.
Yeah.
Twitter is the best social media app, and you can directly reach whenever I need assistance from US doctors, I directly tweet them
Mm-hmm.
and share my experiences, and they also
Yeah.
share their experiences, and I'm able to manage patients in a much better way. In
Better
fact,
ways, yeah.
so Twitter is the one that you
Okay.
should focus on, I should rather
Mhm.
say. And Instagram should be there, but only what exactly these societies you can get attached to. Like I am a
Okay.
hematologist, so I generally attach to the thalassaemic societies,
Yeah.
sickle cell society, which I can help, which they
Mhm.
can, I do sessions for sickle cell as well as thalassemia warriors and do transplant
Mhm.
sessions, do stem cell transplant, what are the issues and concerns. So outreach programs, the focus should be different. The
Yeah,
focus should
I
be
agree.
your
Mhm.
goal oriented
Yeah.
focus rather than otherwise you'll waste
Yeah, yeah.
time.
I mean, now that it's like a crucial time, there's so many
Yeah,
distractions like around you. Like I totally agree with
you're
that.
right, absolutely. The mentors, the things that you really want to become, you have to choose your mentor from the social media, who is the
Mhm.
best surgeon in like United States, and you are doing like anatomy majors in anatomy, and you have to make him a mentor, that I want to become like you, and I just follow all the feeds from you, I learn from your tweets and all those things, and you can directly reach to him by a direct message or DM. You can DM them,
Yeah.
and you can learn from them. You can, I want to
Mhm.
shadow you, I want to shadow you, just I want to become like you, so I'm pretty interested in becoming a surgeon like you. So you can directly tweet them, touch base with them. The social circle tells what exactly your focus gonna be, whether you are just out of the focus, because 95 to 96% of the persons are like out of focus.
Yeah.
Only
Totally.
the focused guys are reaching to the people they really want to become, and they learn from them. They
Mhm.
become their mentor, and eventually they are very successful in their life because they
Yeah.
are following a good
Mhm.
person or a mentor.
No, I agree like so much on like creating like the outreach group and the community. But since we're almost at the end of the session, I really want to ask you like, do you have like a special like motivational message or like a quote that you would share with us for just like little ending um for this podcast or YouTube, whatever people are watching?
Yeah, I really do have a quote.
Mm-hmm.
So the focus is the key, and what
Yeah.
exactly drives your focus,
Mm-hmm.
is the key thing that you're gonna use it so that you are able to attain what exactly you want to become. There should be a purpose
Yeah.
of of the things which you are doing, and what exactly you want to come up out in the out there actually, in fact. So there should be a purpose that should be there uh, of your life, like the things
Mm-hmm.
that you're gonna do, so that you are recognized for it, in fact. So if you like research, I want to gonna be a full-blown researcher. I just will focus on a lot of new things, making new things, and publishing those things, and outreaching all the people whom can benefit with my research. So if you want to be a researcher, then you have to make a focus like this, because if you want to be seen, you have to be super focused, and you should be liking that thing, like from your heart. It should come from your heart that this really suits me. And I gonna do the best in this field, and I
Mm-hmm.
gonna be the best in this field, and I would be recognized all over my country or world
Yeah.
for it. So the main things, again, the decision is from the major, and the decision is, the path is very, very, it is not a straight path. It is
Yeah.
a lot of thorns, lot of
Mm-hmm.
troubles that you gonna face. It is never a straight path. Lot of hurdles would be there in order to you like becoming a surgeon or a medicine
Mm-hmm.
guy, or a cardiologist or something like that. So lot of hurdles you have to face, but the focus should be there that I gonna fix the heart. I'm gonna do it and do it and do it, and I really love it. So then you would be able to attain it, rather than that guy is doing this, then I should be doing this. That should be
Yeah.
not a focus. The focus comes from within, and what exactly you feel like when you do it. If you
Yeah.
really like it, then go for it and just make it a focus.
Mm-hmm.
That's the key thing.